Hey, I'm Casey. I'm going to be your nurse today. And I'll just take a look at your bracelet here. If you'll tell me your name, date of birth.
Whitney Looney, 1386.
Okay, and Whitney, tell me what day it is.
It's the 22nd of November.
Okay, good. And do you know why you're here today?
Just here for my well check.
Well check.
Yeah.
Okay, good. Do you have any problems, concerns you want to address today before we get started?
Not that I can think of.
Okay, all right, good. So, patient's alert and oriented, appropriate mood and affect, appropriately dressed for season and circumstance. As we go along, I will look at skin, hair, nails, and just kind of start at the top and work way down. So as I start to look at the head, I do want to kind of look through your hair, Whitney, if that's okay, just to make sure there's no kind of lesions, and I like to wear gloves for that. Let's start there. Have you had any kind of tenderness or any kind of pain, lumps, bumps, nodules? Good. Yeah, so hair is evenly distributed. I don't see any kind of sign of any lesions. I don't feel anything. Hair's thick, well groomed. So no problems there. Your hair's not falling out. No kind of.
No
Okay.
issues with hair.
Okay, good. And I didn't feel anything back there, so that's good. I do just want to kind of feel your lymph nodes right in here. You let me know as we go if anything hurts, okay? Good. Submental, submandibular. Good. I don't feel any kind of swelling. And you haven't noticed any kind of swelling, right? Okay. Nothing down in here. Good. Okay. Now, do you have any history of headaches or sinus pain, pressure?
No.
No. And we've already checked your vital signs, and those were normal when you came in. Blood pressure looked great. No kind of fever. Have you had any kind of fever, weight loss, chills, any of those? Good. How much sleep are you getting?
About 6 hours, 7 hours a night.
Okay. Okay. Is sleeping a problem or no? Good. All right. So what I want to do, let's take a look at your eyes. I know we checked your vision on the way in, and so vision was 20/20. It's corrected. You wear contacts, right?
Correct.
How often do you see that eye doctor?
Once a year.
Okay, good. All right. No problems there. They've never seen anything within your eye that's concerning.
No.
All right, good. So I want to kind of start and look at your cranial nerves, okay? And I kind of like to do those and just get them wiped out all at once. So let's go ahead and let's start with the first one and get that out of the way. I'll take these off and do some hand hygiene since we're done looking at your hair. All right. So, all right, here we go. I want you to close your eyes for me. And so I just have kind of a pretty familiar scent, okay? I want to make sure that first cranial nerve is intact. I want to check your smell, okay? So if you will include or close one nostril for me. All right. Tell me what you smell.
Coffee.
Okay. Change sides for me. And again.
Same coffee.
Good, perfect. And it is coffee beans. You haven't noticed any kind of change with any of that, right?
No.
Smells good. Okay. Let's take a look at your eyes. I don't. Oh, we can dim. Good. Okay. So dim the lights, and I just want to look at your pupillary reflex. Make sure both sides are equal. They're reactive. So here we go. You just look straight past me, okay? There we go. All right. Just look straight for me. Good. Good. All right, about a 2, perfect. And again, just look straight at me. All right, oh, that looks good. So now what I want to do is test your, test the way your eye moves. So we call it cardinal fields of gaze. I want you to just follow my finger, okay? So you can follow the pen light. So we're going to start right about the middle. good. Perfect. Yeah, okay. So all of that looks good. Have you had any kind of eye drainage, discharge, blurriness, problems at all with your eyes?
No.
Okay, good. And so, what I would want to do is to take the ophthalmoscope and kind of look at that red reflex within your eyes, look at your macula, make sure all of those things are good. Look at those blood vessels and the disc. For the sake of time and equipment, we're going to bypass that today, okay? So within your eyes, I mean, everything looks to be normal for me. Next, what I want to do is we want to look at your ears, okay? So we'll put that down. Okay, now you let me know if any of this hurts, okay? As I'm mashing on your helix and pulling down here. Any of that hurt?
No.
No, okay, good. Let's look at the other side. Yeah, so they are symmetrical. I see no kind of obvious discharge, no kind of lesions or bumps. How about behind your ears here? Does that hurt? Okay, good, good. Do you have a history of ear infections?
No.
No problems at all with your ears? Okay. So I would take the otoscope and take a look down in there within the canal. Externally, everything looks great. With the otoscope, I will be able to look more at that tympanic membrane. Would want it to be kind of that pretty pearly gray color, no scarring or bulging or anything like that. So now what I want to do, your gross hearing is intact. You can hear me. You're answering my questions appropriately. Have you noticed any kind of decrease in hearing at all?
No.
No? Okay, good. Ears don't feel full or anything like that, like you're underwater?
No, no problem.
Okay, okay, good. So that cranial nerve, I would consider that to be intact just with gross hearing. But what I want to do is another kind of test, kind of looks at some bone and air conduction, okay? So what I'm going to do is take this, I'm going to kind of hit here, and I'm going to place it on the center of your head. And what I want you to do is tell me if you hear it equally on each side or if one side is greater than the other, okay? What do you think?
Equal.
Equal?
Mhm.
Okay, one more time just to be sure.
Equal.
Good, perfect, okay. So ears look to be good. Okay, so we looked at your sense of smell. Let's look a little bit more at your nose and make sure everything's good there. Have you had any kind of nosebleeds?
No.
Good. Yes, everything looks to be good. I don't see any kind of swelling, bleeding, no kind of deviation there. Septum looks good. Do you have problems with like seasonal allergies or nasal stuffiness?
Sometimes, but not right now.
Okay, okay, good. So again, there's your patent. Everything looks to be normal there. Next, I want to take a look in your mouth, okay? I'll put some gloves on for this. And already, what I'm seeing is that your lips are moist, they're not dry or cracked. No kind of cyanosis or bluish discoloration there, so that's good. And again, vital signs were good, pulse ox was normal, so that tells me that you're breathing good, okay? So let's see here. If you can say, ah. Good. Just gonna take a look in here. Yeah, perfect. And stick your tongue out for me. Good. And can you kind of move it side to side? Perfect. Okay, lift it up again for me. Perfect. Okay. So I am seeing no kind of lesions. I'm not seeing any kind of irritation within there. Mucosa is moist. No kind of dehydration that I would suspect from that. Teeth they're all there. They are clean. They're what I would expect. I see no kind of signs of cavities or obvious caries. I do want to take a look. Let's take a look and see if I can see that Stenson stuffed in there. A little bit of light helps us see. Yep, and there it is. Good. Now, tell me about your tonsils. You ever had any kind of swelling or problems there?
No, I still have them.
Okay, good. And they look good to me. They don't look swollen, so that's what I would expect. Looks to be normal there. I do want to check another one of your cranial nerves and check your gag reflex, okay? It's a little uncomfortable. I'll try to be quick. And I also want to make sure that, so your uvula is there, is midline. I want to make sure it stays that way, okay? So what I want you to do is say, ah. Perfect. Okay, so I'm seeing that palate's raising, uvula stays midline. Perfect. Here we go. Okay, good. Gag reflex is intact. I know nobody likes to take those off. All right, perfect. So far so good. I want to take a look kind of at your neck here. So everything looks, I mean, I see no kind of jugular vein distension just by looking. Turn your head for me. Yeah, perfect. And again, yep, so that all looks good. Now tell me about your thyroid. Have you ever had problems with thyroid? Any family history of cancer?
No.
Okay, your range of motion's good. I see you turning, so good. Have you had any kind of pain or anything within your neck?
No.
All right, so I want to kind of come behind you and I want to feel your thyroid, okay? So, let's see here. Okay, now I'm going to kind of displace just a little. Okay, swallow good for me. Good, okay. Now let's displace to the other side, and again. Perfect. I'm not feeling any kind of lumps or bumps there. Feels pretty normal. Trachea, midline, everything looks good. We did feel your nose. I don't see any kind of swelling. I didn't feel any earlier. So good. Nothing down in here. Nothing back in here. Okay. Good. Sometimes those can get a little flared up if you have some kind of allergy problem or just basic cold. So good. Okay. So next what I want to do, I want to take a look at your breast, okay? Now tell me a little bit about family history. Any history of cancer at all?
No.
Good. Any kind of breast surgeries or biopsies, any lumps, bumps?
No.
Perfect. Okay. Are you breastfeeding?
No.
Okay, good. How long ago? I know you have a child.
It's been 10 years.
Oh, perfect.
Yeah.
Okay, good. So you've not noticed any kind of dimpling or any changes at all to your nipples or breasts?
No changes.
Good, good. Okay, go ahead and lay back for me. Yeah, be comfy. There we go. For the sake of time, I'm only going to do one side for this presentation. All right, dear. And if you will, perfect, you already know. Okay, so you're gonna feel me kind of up here in your underarm, which is kind of where we want to start, and come down. Come under. Good. I like to kind of do a linear pattern here to feel. I'm not feeling any kind of lumps. I know sometimes your breast tissue can change around your menses. When was your last?
It's been a couple weeks ago.
Okay. So again, no tenderness or anything there. Okay, perfect. You can sit back good. Okay. And are you doing self-breast exams at home?
I am.
Okay, good.
Yes.
Perfect patient. Okay, good. So if you notice anything come up or have any concerns, please let me know, okay? So let's see here. Looks normal, felt normal. So again, just keep an eye on that, okay? So now let's go ahead and we'll move on to your chest. So what I'm seeing, let's have you sit up, and because I want to listen and look, and now we've got you covered for privacy. So, all right. So what I'm looking at is normal, normal shape, and I see no signs that you're struggling to breathe. I see normal chest expansion, no kind of labored breathing at all. So that's good. I'm gonna start on this side of you. Just gonna take a listen. Let's go ahead and start with your respiration. So you take a deep breath. Good, good. And then I want to kind of come, let's kind of go under here. Yeah. Deep breath. Good. One more. Okay. Yeah, good. So I don't hear any kind of adventitious sounds or sounds that, any abnormal breath sounds, okay? So that's good. Breath sounds were even in all parts of your lungs. I didn't hear that one side's greater than the other. So same thing, I'm gonna kind of just listen to your back, okay? Listen to your lungs. Okay, take a deep breath. Good. Perfect. Now listen to that lower lobe. Good, and again, it's the same, so perfect. So next I want to take a listen to your heart. No problems at all with your heart or history of problems? No. Okay. All right, so let's see here. I guess we can start. I know your vitals were normal. I just want to go ahead and feel too. If I can feel them both together. Look for those pulses. Good. About a 2. Let's feel up here. Good, same. Okay, good. Feel here. Perfect. And I like to feel together except for the carotid. We do one of those at a time. Perfect. Yep, good and strong. I don't feel anything abnormal there. Yeah. Okay. So let's take a listen. And you can just breathe normal and relax, okay? And that makes it a little harder. Good, okay. I'm not hearing any kind of murmur. S1, S2, everything sounds good there. Good and strong and exactly what I would expect. We hit some of your pulses. I want to go ahead and check for the others. We can just, for privacy, I'm going to leave your pants down, okay? I'll make you pull those up. Okay, so those are popliteal, good. I'm going to slide your shoes off. There you go. Perfect. You're going to feel for those pedal pulses. Kind of tricky, but there it is, yep. Good, 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 strong. Okay, perfect. I want to feel kind of back here. Okay. Again, for privacy, we're going to bypass femoral. So tell me a little bit about your stomach. Any problems at all? When's your last bowel movement?
Today.
Okay, good. No problems, no diarrhea, nausea, vomiting?
Regular.
Good, okay. No kind of bloody stools or changes?
No.
Okay. Let's take a look. If you can lay back down for me. Just want to take a look at your abdomen. I'm going to raise just a little bit. Okay, good. I see no kind of scarring, and you have a child, right? Okay, good. Everything looks normal. I'm going to come on your other side there. No kind of scars. I see no obvious bulging or lesions. Flat shape. All right, let's take a listen. I don't want to mash on you too much without listening. We'll start kind of low here, right lower. Yeah, when's the last time you ate?
Just a little bit ago.
Okay, yeah, they're definitely active bowel sounds. Good. I'm hearing it all 4 quadrants. Perfect. So you can lay down still just for a second. What I want to do is kind of feel your belly. Okay, so just gonna lightly touch it first, and then I want to kind of go a little deeper. Okay. Anything hurt? Good. Yeah. So non-tender, not distended. Looks good. I'm gonna come on the other side real quick. Let's see about your liver. All right. So what I want you to do is take a breath in and out and hold. Perfect. Okay, good. And I don't feel it, and you shouldn't. All right, have a seat, or sit up for me. Okay, so that's all good. Now, I want to take a look at your musculoskeletal system, make sure everything is good. I saw you walk in. I know your gait is even. It's not unsteady or anything like that. So perfect. Have you had any kind of falls recently?
No.
Okay, good. You can turn and face me. Get just a little bit to your right there. Perfect. Okay. Now, I want to look at upper extremities. So kind of hold them out for me. Close your eyes. Perfect. Good. Yep. So it's staying even. Sometimes when people have had a stroke, you'll see one drift up. So what I want to do next is kind of take your arms out, bring them back in. Good. And can you rotate them, circumduct? Perfect. Okay. I want to take a look at your spine, and then I'll have you sit down, and we'll look at your lower extremities. All right. Bend over for me. Take a look here. Good. So, yeah, that's pretty far as good as you can. Yeah, spine looks good. I don't see any kind of curve there. You can have a seat again. Perfect. To be even, in line, no kind of movement. So what I want to do next, so with your arms, you can kind of hold them up. I'm going to push against you, and what I want you to do is push against me. Perfect, good and strong, okay? And let's do the same with your legs. Perfect, yep. That was a little tricky, huh? Sitting down. Okay, so again, gait's good, range of motion's good. All of that looks good. Spine's good. So let's do this. I want to check your reflexes. Let's go ahead and let's see here. Bicep, tricep, inter. Okay, here we go. Just gonna feel me tap. Good, good. Okay. And so this one, I'm gonna have your arm bend it for me and hang it. Perfect. All right, and again. Good, good. So let's take a look here at your patellar reflexes. Good. Yeah, and I would want to check everything, both sides, of course. So, next I want to do your plantar. Okay. Good, good, strong. I'd say probably +2. And again, good. Okay. I did want to also look at kind of some sensory things, make sure there's no kind of disruption in what you're feeling, okay? So if you would, close your eyes for me. I'm gonna do your cheeks, and then we're gonna move to your feet, okay? And I wanna get your hands too. You can kind of lay them there, good. So what I want you to do is tell me if it is sharp or dull, okay?
Dull.
Good.
Sharp.
Yep, good, good. And that's just checking your cranial nerves. So let's see here. Again, keep your eyes closed. How about this?
Dull.
Mm-hmm.
Sharp.
Perfect. Yep, one more.
Sharp.
How about now?
Dull.
It's good. One more.
Dull.
Perfect. Yep. Okay. All right. Now, let's get to those feet. I'll just do this one side here. Okay.
Oh,
Perfect.
sure.
Yeah. Good. All right. So that looks to be normal. And I didn't see any kind of swelling down here. You haven't noticed any swelling?
No.
Ankles are good, so no edema.
No.
Perfect. Yeah. Even with your socks, you have no kind of indentation. That's good. Okay. Let's check your capillary refill, and I think that will be about it. All right. Perfect. Good. Okay, so immediate, I mean less than 2 seconds. It's good. That's what we expect. Do you have any questions for me?
No, that's good.
Okay, all right. Thank you.